What I'd like to talk a little bit about is how health insurance works. When it comes to your average health insurance policy, there's three basic principles. The first principle being deductible. Now, everyone's heard of the deductible. That's what you pay out of your pocket. That's what comes first. Normally, your deductible, $500, $1,000, $1,500, and so on. That's what comes out of your pocket first. That's your deductible. What a lot of people don't understand that in most individual major medical policies, you can reach that deductible multiple times. For instance, if you had a $1,000 deductible, you could potentially reach that deductible 3 times, which means your deductible exposure for the entire family would be $3,000. A lot of people don't quite get that. They say, well, I got a $1,000 deductible. Well, you got a $1,000 deductible, but if multiple people in the family need the deductible or have a problem throughout the year, you couldn't meet the deductible up to 3 times. But that's what comes first, your deductible. After deductible is coinsurance. I love talking about coinsurance because everybody says they understand coinsurance, but when I ask them, they can never explain it to me. Coinsurance is what comes after the deductible, and because it's called coinsurance, it means you pay and the company pays together. The most common type of coinsurance is 80-20. Everybody's heard of 80-20, 80-20. What's that mean, 80-20? Normally, it means the company pays 80% and you pay 20%. But to what level? With most companies, it's 80-20 of $10,000, which means you are responsible for 20% of the next $10,000. Well, 20% of $10,000 is an out-of-pocket of $2,000. So your out-of-pocket exposure on the coinsurance of 80-20 of $10,000 is $2,000. Now, like the deductible, the coinsurance can also be met multiple times in a policy. Most of the time, it's 2 times. So times 2, your total coinsurance exposure for the family would be $4,000. So for your basic $1,000 deductible 80-20 major medical plan, that tells me most of the time your out-of-pocket exposure on your deductible is $3,000. Your out-of-pocket exposure on your coinsurance is most likely $4,000 because you're probably 80-20 of $10,000. Could be 80-20 of $5,000. Could be 80-20 of $15,000. That's something to pay attention to make sure you know exactly how those numbers work. After the deductible and after the coinsurance, then you have your lifetime maximum, which with most companies is around, well, we'll say $3 million. And that's per person. So that's your basics of health insurance. And that's, if you understand that, you can pretty much apply that philosophy to every health insurance plan you're ever going to see. Deductible, coinsurance, and lifetime maximum. That's it. But in today's day and age, there's really 4 and 5. 4 being doctor office copay. You know, a doctor office copay, that's when you go to the doctor and it costs you, say, $25 to go to the doctor visit. You know, what I try to tell people is, you know, let's say you and the family, let's say you go 8 times throughout the year. If you go 8 times throughout the year, you're going to spend $200 in doctor office copays. Just to have this benefit on your policy is going to probably cost you, it's probably going to cost you $100 a month. $100 a month, just so you can pay the $25. If you decided not even to take the doctor office copay and just go without one, which is what I recommend, how much is a doctor visit? Let's say doctor visits, let's say it's $80. $80 out of your pocket times the same 8 visits, I mean, that's going to be $640. But remember, you were paying $100 a month, that's $1,200. Plus you were paying the $25 doctor visits, that's $200. That's a lot better number, isn't it? Take one more thing into consideration. This $80 doctor visit, if you paid it yourself, is going to get repriced through the network. Here in Central Indiana, it's the Sagamore network, but wherever you are, whatever the network is going to reprice the $80 as much as 40%. Let's say the $80 is going to go to $50 after it gets repriced through the network. Well, now times 8, you've only spent $400 out of your pocket. My goodness. Don't take the doctor office copay. You'll spend $400 instead of $1,400. And you can take this off your deductible. You can take these expenses off your deductible. This $200 here, you cannot take that off your deductible. And let's say you don't have to have a lot of doctor visits throughout the year. Let's say it's been a good year, it was a healthy year. Well, you just save the money. And you don't, if you have a good year down here when you're paying the $100 a month, you're still paying the $100 a month. So I'd like to talk a little bit about doctor office copays. Number 5, everybody probably could guess, prescriptions. Prescriptions are pretty simple. The way most prescription plans work, you have, let's say you have a $10 generic drug card, $25 brand name. In addition to that, you may have a deductible that you have to, a separate deductible for your prescriptions that might have to be met before your $10 generic drug card kicks in, before your $25 brand name drug card kicks in. You know, a lot of times just having a drug card on your plan might cost you $75 a month. Just to have this on your plan, whether you're taking any prescriptions or not. What I tell my customers, especially the ones in good health, is listen, you can get your prescriptions at Walmart, at CVS. Generic prescriptions, I think the average generic prescription is $4 now. In most cases, save the money on the prescription card. You don't normally have to take this option. If you're not on a lot of prescriptions, don't take it. Save the money, buy your prescriptions yourself. If you buy them yourself, they still count towards your deductible. So these are the basics of individual health insurance. Deductible, coinsurance, lifetime maximum, doctor office copays, and prescription cards. What I like to talk to my customers about is what is the best value? How do you save the most money? And in my opinion, unless you're going to the doctor 20 times a year, which if you are, you're probably not going to get approved for the insurance. Unless you're going a ton of times, don't take a doctor office copay. It doesn't make sense. It's not a good value. The same thing with the prescription card. Unless you're taking a ton of prescriptions, which if you are, they're not going to accept you. Don't take the prescription card. Buy them yourself. Take them off your deductible. And I think if you follow these kind of steps and you understand how this works, you can give yourself kind of the best chance of picking the best plan suitable for you. Thank you.